When you turn 65 and become eligible for Medicare, you have to make a decision that most people are completely unprepared for, and unlike a lot of financial decisions in life, this one has real teeth. Do you stay with Original Medicare, the government program that's existed since 1965? Or do you go with Medicare Advantage, a private insurance alternative that's become enormously popular over the last decade? Here's the truth, there is no single right answer. Both options have real advantages. Both have real drawbacks. And which one is better for you depends entirely on your health, your lifestyle, and your finances. By the end of this video, you'll understand the key differences, see them side by side in plain English, and know exactly which questions to ask before you decide. Let's start with the basics.
The benefits desk.
Original Medicare is the federal government's health insurance program for Americans 65 and older. It has two main parts. Part A covers inpatient hospital stays, skilled nursing facility care, hospice, and some home health services. Most people don't pay a premium for Part A if they or their spouse worked and paid Medicare taxes for at least 10 years. Part B covers outpatient care, doctor visits, lab tests, preventive screenings, mental health, and medical equipment. The standard 2026 Part B premium is $202.90 per month. And you pay this premium whether you're in Original Medicare or Medicare Advantage. Under Original Medicare, you can see any doctor or go to any hospital in the United States that accepts Medicare, and the vast majority do. No network restrictions. No referrals needed to see a specialist. You have full freedom of choice. But Original Medicare has a critical gap that most people don't realize until they need expensive care. That's right. There is no annual cap on what you pay out of pocket under Original Medicare. The government covers 80% of most Part B services. You're responsible for the other 20% with no ceiling. For a major illness or surgery, that 20% could be tens of thousands of dollars. That's why most people who choose Original Medicare also purchase a Medigap supplemental policy, sometimes called Medicare Supplement Insurance, to fill in those gaps. We'll come back to Medigap shortly. Medicare Advantage, officially called Medicare Part C, is an alternative way to get your Medicare benefits through a private insurance company that's been approved by Medicare. Here's how it works. Instead of the federal government paying your medical claims directly, you enroll in a private plan. That plan receives a fixed payment from Medicare each month to cover your care. And in exchange, the plan is required to cover everything Original Medicare covers, plus often a lot more. In 2026, the average Medicare Advantage plan charges an additional premium of around $14 per month on top of your Part B premium, though many plans charge zero extra. Some have even lower costs than Original Medicare alone. Medicare Advantage plans typically bundle in prescription drug coverage, something Original Medicare doesn't include. Many plans also add dental, vision, hearing care, gym memberships, over-the-counter allowances, and even meal delivery or transportation to doctor appointments. And here's the feature that often tips people toward Advantage: every plan has an annual out-of-pocket maximum. In 2026, that cap is $9,250 for in-network services, though many plans set theirs lower. Once you hit that ceiling in a given year, the plan pays 100% for the rest of the year. Original Medicare offers no such protection. However, Medicare Advantage comes with a trade-off that matters a lot for some people. Most plans restrict you to a network of doctors and hospitals in your geographic area. And many require prior authorization before you can receive certain procedures or specialist care.
The benefits desk.
Let me put both options side by side so you can see the full picture at once. Let me highlight a few rows that tend to surprise people the most. First, the out-of-pocket maximum. This is the biggest structural difference between the two. Under Original Medicare, there is no cap. A serious illness can cost you $50,000, $80,000, or more out of pocket unless you have Medigap. Under Medicare Advantage, your worst-case scenario is capped in 2026 at $9,250, though many plans are lower. That protection is real. Second, Medigap. If you choose Original Medicare, you have a one-time window right after you first enroll to buy a Medigap supplemental policy with guaranteed issue rights. That means no medical underwriting, they have to accept you regardless of your health. Miss that window and sign up for Medicare Advantage instead, then decide later you want to switch back? In most states, insurance companies can deny you Medigap coverage or charge you dramatically more because of pre-existing conditions. Third, prior authorization. This is a growing concern with Medicare Advantage plans. Before certain procedures, specialist visits, or hospital stays can be approved, you may need the plan's permission first. With Original Medicare, that administrative layer largely doesn't exist. If we're being honest about the Original Medicare versus Advantage comparison, we have to talk about Medigap, because for most people, Original Medicare alone is not a complete plan. Medigap, also called Medicare Supplement Insurance, is a private policy that fills in Original Medicare's cost gaps. The most popular plan, Plan G, covers your Part B deductible, the 20% co-insurance on doctor visits, excess charges, and more. In 2026, Plan G premiums typically run anywhere from $90 to $200 per month, depending on your age and where you live. When you add up Part B at $202.90, plus a typical Plan G at $130 per month, plus a Part D drug plan at around $40 per month, you're looking at roughly $370 to $450 per month total for comprehensive Original Medicare coverage. Compare that to a Medicare Advantage plan at $0 to $30 extra per month, and it's easy to see why Advantage looks attractive on paper. But remember, with Original Medicare, plus Medigap, your out-of-pocket costs for covered services are nearly zero after you meet the Part B deductible. With Advantage, you may pay copays every time you see a doctor, and your total out-of-pocket exposure in a bad year can reach $9,250. The better deal depends entirely on how much healthcare you actually use.
The benefits desk.
Here's the honest answer: neither option is universally better. It depends on who you are. Use this decision guide to see where you land. If you travel a lot or live in multiple states, you should consider Original Medicare. Why? Because network restrictions can leave you without coverage. If you want dental, vision, and hearing covered, you should consider Medicare Advantage. Why? Because these are not in Original Medicare. If you have a chronic illness like cancer, heart disease, diabetes, etc., you should consider Original Medicare plus Medigap. Why? Because you get unlimited specialist access at a predictable costs. If you're healthy and want lower monthly costs, you should consider Medicare Advantage. Why? Because there are premium plans at $0 available in many areas. If you have a fixed tight budget, you should consider Medicare Advantage. Why? Because the out-of-pocket maximum protects against catastrophe. If you want to see any doctor without referrals, you should consider Original Medicare. Why? Because you have freedom to see any Medicare accepting provider. If your current doctors don't take Advantage plans, you should consider Original Medicare. Why? Because you avoid forced provider changes. If you want everything bundled in one plan, you should consider Medicare Advantage. Why? Because you get Part A plus B plus D plus extras, one card, one premium. If you're newly eligible at 65 and Medigap window is open, you should consider Original plus Medigap. Why? Because the guaranteed issue rights expire, this window won't return. One critical warning. If you are turning 65 and considering Medicare Advantage, know that switching back to Original Medicare later, especially to add Medigap, may be difficult or impossible in most states if you develop health conditions. Many people feel trapped in Medicare Advantage after getting sick. If in doubt, Original Medicare with Medigap during your guaranteed issue window is the more flexible long-term choice. One more thing worth knowing, you're not locked in forever. During the Medicare annual enrollment period October 15th through December 7th each year, you can switch between Original Medicare and a Medicare Advantage plan. But that Medigap guaranteed issue window only comes once. So plan accordingly. Here are 4 steps to help you make your decision. Step 1. List your current doctors and check their Medicare status. Go to Medicare.gov/care, compare and check whether your doctors and preferred hospitals accept Original Medicare. Then call each one and ask, do you accept Medicare Advantage plans, and if so, which ones? Doctor availability varies dramatically by region. Step 2. List your medications and check formulary coverage. If you're comparing Medicare Advantage plans that include Part D, use the plan comparison tool at Medicare.gov to see if your prescriptions are covered and at what tier. A plan that doesn't cover your drugs could cost you far more than the premium savings. Step 3. Honestly assess your health and risk tolerance. If you're generally healthy and want lower monthly costs, Medicare Advantage may serve you well. If you have a chronic condition, see multiple specialists, or want total freedom of provider choice, Original Medicare with Medigap is likely the smarter long-term play. Download the comparison worksheet in the description to run your own numbers. Step 4. Call a licensed Medicare broker, not just a plan's own agent. An independent Medicare insurance broker can show you plans from multiple companies and help you compare. They're typically paid by the insurance companies, so their service is free to you. A good broker will show you both Original Medicare and Advantage options without pushing one over the other.
The benefits desk.
Let's recap the key points from today. Original Medicare equals federal government. Any doctor, anywhere. No out-of-pocket cap. Medicare Advantage equals private insurer. Extra benefits. $9,250 out-of-pocket cap in 2026. Original Medicare works best paired with Medigap, somewhere between $370 to $450 a month total. Advantage works best for healthy seniors wanting lower monthly costs and bundled extras. Medigap guaranteed issue rights are a one-time window, don't miss it. You can switch plans each year during annual enrollment, October 15th to December 7th. This is genuinely one of the most important financial decisions you'll make in retirement. There's no rush, but there are deadlines. The more time you give yourself to compare, the better the outcome. Subscribe to The Benefits Desk so you don't miss our upcoming videos on Medigap plan types, how to read your Medicare summary notice, and more. And grab the Medicare plan comparison worksheet in the description. It walks you through all the key numbers for both options, side by side, based on your specific situation. See you in the next one.
And remember, like, subscribe, and hit that bell button so you get notified when we upload more content.